Today we're going to be trying out a Jubilee video and trying to figure out who the real doctor is in a group of 6 people. I'm very excited to try this out. I'm sure all of you guys have watched Jubilee videos before where there's like a fake person or imposter that they have to find. And I feel pretty confident that in a group of 6 people, only one of whom is a doctor, I should be able to figure out who this is. So I'm definitely looking forward to trying this video with you guys.
When you guys were on call, what was your least favorite thing to be woken up by?
I got a little bit annoyed with the Tylenol call, but you know, I had to do what I had to do, so.
I don't think that guy's a doctor. I mean, yeah, the Tylenol call, I think that's what a layperson would think, especially if you're in emergency medicine. The Tylenol call is the least of your worries. It's so easy to put in a Tylenol order, so he is not a doctor. I'm already calling it.
I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
Doctor. Herpes in their eye, is it that unpleasant for an ophthalmologist? I don't know. I'm a little sketch about that one already too. That seems like a pretty normal thing that an ophthalmologist might have to see.
5 are posers, 1 is the real deal. In a room full of liars, can these teens find the real deal?
So, how are we feeling?
Oh, we're feeling good. We're feeling good.
Yeah, I feel like maybe a little more confident than I should be now that I get a look at you.
They ain't ready. They ain't ready.
So this is interesting. So it looks like it's a group of 3 people who are trying to figure out who the real doctor is. And none of them are, I don't know if these people who are judging are doctors themselves or if they're lay people. They're probably going to be lay people because it'd be harder to fool a real doctor than a lay person, I think. So we'll see.
Okay, numbers 1 through 6 in that order. Could you tell us your specialty?
Okay, they're nurses. They're nurses. That's like, I like that twist. So these 2 are nurses. The other 2 are MDs. We'll see.
And what school you went to?
I'm a dermatologist and I went to UCI.
I'm a urologist and I went to University of Tennessee.
I don't know. I don't get doctor vibes from that guy. I don't know why.
I'm an emergency doctor and I went to UCF as well.
Physical therapist, Rutgers University.
Physical therapist. I mean, yes, they're doctors of physical therapy, but that's completely different. I feel like this is not what people are colloquially referring to. So it's still weird that he's in there, in my opinion.
I'm a pediatrician and I went to Drexel University.
She sounds like a doctor. I'm gonna just put it on my. I'm just gonna put it down right now. Obviously, it may change, but I'm gonna put my nickel down on her for right now. She sounds like a doctor.
I'm an optometrist and I went to Southern California College of Optometry.
Number 6.
I see. It makes it harder because there's a doctor of physical therapy and a doctor of optometry. They're not what I would have been kind of guessing for this kind of a show, but we'll see what happens.
Can you tell me what 20/20 vision means?
Yeah, so basically it's kind of complicated. There's a lot of like physics to it, but there's a certain angle that's subtended by the letters that are on the Snellen chart that you're looking at. And so they standardize that at 20 feet distance. So if you're 20/20, you're seeing what someone should be seeing at 20 feet. But if you're 20/30, what someone can see at 30 feet, you need to be standing at 20 feet in order to see.
When you guys were...
Okay, that was a pretty legit explanation, but I wonder how much time... I think all these people probably get time to like research what role they're going to play beforehand. So they're probably going to have pre-canned or prepared answers for common questions that they think they'll get.
On call, what was your least favorite thing to be woken up by?
During my residency, I actually had a case of Stephen Johnson's and that was very scary to see.
A large
Okay, that was a very good choice. That's definitely the number 1 like dermatologic emergency that really they need to come in for.
accident with fatalities is always a grim scene to come into, especially if children are involved. So that's the worst thing that I've ever had to do.
Okay, no, he is not a doctor. This is way too big. A large accident with fatalities for the urologist? No.
Grim scene involved.
Got a little bit annoyed with the Tylenol call, but you know, I had to do what I had to do, so.
My emergencies are
too vague. He's not a doctor.
Mainly during like a practice or a real game. I've had ankle injuries that needed to be like lowered inflammation and put ice packs or certain, massage therapy.
I think just
No, that was way too vague too. He's not a doctor. He's not a physical therapist.
seeing any babies in pain and then seeing like a tragic loss is the hardest thing.
I haven't been on call.
That was just kind of vague. Okay, she's falling down a little bit on my list. That was just kind of vague.
as much, honestly, but I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
I think you'd be thinking. Think what I'm thinking.
What I'm thinking.
I'm thinking what you're thinking.
Eliminate
Okay,
urologist.
we're ready to make an elimination.
Eliminate urologist. That's 100%.
Each team will try to find the real deal by eliminating the imposters. If both teams eliminate the same person, they will be removed from the game.
When you ask about why they don't like being called at night, you know, it's so sad, and the children and this like general thing, I was like, okay, that's nice, but meh.
How long have you been practicing since, well, you're still in residency, so since out of residency?
I have been out of residency for a little over a year.
I graduated in 1993 and went right into work, so 28.
I graduated medical school at 2021.
I've been practicing for 15 years.
I finished my residency at USC
PT residency? What is going on? Physical therapy residency? Is that a thing?
Medical Center 5 years ago.
And I've been out of school for 1 year.
Doctor number one, I have a question.
Wait, I want to clarify that, because if he said physical therapy residency, which I don't think, as far as I know, is a thing, if he said graduated residency, like he is automatically out as well.
At 2021.
I've been practicing for 15 years.
I finished
Okay, he didn't say residency. That's just what they put there.
my residency at USC Medical Center 5 years ago.
And I've been out of school for 1 year.
Doctor number one, I have a question. For the medical terminology, intra versus inter, since you're a dermatologist, what's the difference?
Yeah, so it has been a while since I've been in medical terminology, but I definitely use inter a lot, and that would be inside. And then intra, gosh, I don't remember off the top of my head.
Doctor.
Oh, okay. That's a red flag. I think even if you had been out of medical school for a very long time, you would be able to describe the difference between inter and intra. I feel like I was starting to think she was good because she said Stephen Johnson's, but now I am not very, very not convinced by her. The most common time that we use inter versus intra is like inter observer variability versus intra observer variability. So inter would be like one person and another person, the variability in between them. Whereas intra would be this within the same person, having variability within, them looking at the thing at point X versus point Y. I'm starting to realize if I had been put on the spot to say it, I probably would not have said anything very eloquent. Like, this was not a very eloquent answer. So maybe they would have tagged me as not a doctor. But yeah, basically inter is the difference between two different things, and intra is differences within something.
Number four, can you name me the different kinds of cruciate ligaments? 3?
You said 3?
However many there are.
Oh, we got the anterior, interior. You have a meniscus.
Okay. It's very funny how obvious it is to eliminate these people. So we got 3 people eliminated already: the urologist, the dermatologist, I think, and the physical therapy guy.
Those are the main for knee.
Gotcha. Doctor number 3, what system is the lymph nodes a part of?
The lymphatic system.
What kind of question was that?
Are we allowed to eliminate 2?
No, just one.
Okay.
Confidence, ready.
Did they not think lymphatic
As a
system was correct?
reminder, if both teams eliminate the same person, that person will be removed from the game.
When I asked him to name me the cruciate ligaments, and he answered with
Meniscus.
which is not a cruciate ligament. As a physical therapist, you should probably know that.
Oh, they're medical drama
Doctor
fans.
number
I love
5, could you tell me a common medication that you prescribe for one of your patients?
Benivate, it's for babies that have phimosis before they get circumcised. We try that method first. An average is like 50 milligrams.
Doctor number 5, I had a question for you too. For a baby under 28 days, if they had a fever, how much Motrin would you give them?
Ideally none.
Ooh, she knows her stuff. Okay.
I didn't actually know that. None? Okay.
Go ahead.
Doctor number 6,
The way she carries herself, the poise at which she talks, just already gives me doctor vibes. Even from the very beginning. Remember, I said at the very beginning, doctor vibes. But then what did she say that made me think she wasn't a doctor? I don't know. It was something vague about, like, kids being sick or something being the worst thing she got called in for. But the confidence at which she's, responding to the questions seems pretty doctorish to me.
If a patient had glaucoma, what kind of prescription would you give them?
You could give them something called latanoprost. So it's an eye drop. You'd use that one at nighttime only, in whichever eye had the glaucoma.
And then what would be the abbreviation for nighttime only?
QHS.
Shoot. So she's got some good vibes too. So these two are giving me the best vibes so far.
Our resident, number 3, can you tell me what a normal blood pressure is and then kind of explain to me what those numbers mean?
120 over 80, and 120 is a systolic, so pretty much the amount of blood that's in the chamber before it's ejected, and then the bottom number is basically the resting volume.
1 and 4?
It's not actually, it's not a bad explanation. It's actually a really good question. I like that. I feel like it would be difficult for a layperson to describe. But the fact that he got diastolic is the resting blood pressure, while everything's relaxed is actually pretty good. I will say though, somebody would have just said it's the diastolic. The fact that he didn't say diastolic was a little weird. So I've already had weird vibes from him from the beginning. So I think he did some good studying, but I don't think he's a physician.
What kind of cars you guys drive?
I drive a Toyota Honda Highlander.
So I have
Not a good question. I feel like this is a kind of a waste of a question because doctors drive all sorts of things, and there are people who are driving their cars from the 1990s still, 1990s Toyota Camry or whatever, and so you can see any type. Just because they drive an expensive or fancy car doesn't mean they're a doctor or something.
been driving the same car since I was 15. I drive a Honda CR-V. I am still paying off medical school, so I will be driving that until it cannot be driven anymore.
I think we're ready to make another elimination.
PT guy has to go.
In this round, both teams have decided that one person is definitely not the real deal. Number 4.
We'll miss you.
Thank you.
I would love to hear your
I already
wacky...
forgot what the dermatologist said that made me sus of her, but she definitely said something. I had to try and remember what she said.
Story from a patient on the job. Down the line. Sorry, I'd love to hear from all of you.
So we had a TikTok star in one time, and when I entered the room, he was standing on the medical bed, filming something, pretending he was surfing. So that was definitely very interesting.
It was a vaginal occlusion. She and her friend had been playing around with a bottle and created a vacuum, therefore lodging the bottle in her vagina.
I had
Just tell this guy's just like making things up on the spot. It's very funny. I don't think he did as much prep as some of the other people did here.
this elderly patient. She has some sundowning, some form of dementia, but she kept asking me to go to the bathroom with her to show her a good time.
Like the vibe I'm getting from him is that maybe he's a nurse or he's something in the health field. Because the fact that he knows like the term sundowning and he knows that, you know, the Tylenol call is annoying or something, it kind of gives me a vibe that he knows he works in the health system in some regard, but he just doesn't give me that doctor vibe.
They're asking me, is it okay to put false eyelashes on her newborn baby for pictures?
For me, I had a guy come
That sounds like a really good example. I feel like that would be memorable.
in because he was playing with a Nerf gun, and then I guess he got hit in the eye, and then he ended up having like traumatic uveitis, and then he got some glaucoma as a result from that. So that was pretty crazy.
Nerf or nothing, right? All right, we're good to eliminate.
Urologist gotta go. Yeah, definitely.
Doctor number 2.
Sorry, sir.
Thank you.
Bye-bye. So we eliminated number 2 next because there were very broad answers given. It wasn't very specific to what a urologist actually does.
So this is a question for doctors 3 and 5. You walk into the room and you see the patient's monitor, flatline. You feel their pulse, there's nothing there. How many joules are you going to shock them with? Doctor number 5.
I don't think this is a great question. If they asked us something a little bit more basic, like what should you do immediately? Or what would you do immediately? I feel like that would be a good question. Like start CPR right now, call code blue. The fact that they're asking how many joules to use, I don't think a pediatrician or an EM resident would know. I don't know if a pediatrician would know. But yeah, let's see if this is a helpful delineating question.
5.
And Dr.
Okay, 5 joules. I think even a medical student would know that 5 joules is not correct. So that plummeted her. So maybe this was actually a very good question. 5 joules. Oh.
Number 3.
200.
Dr. 1.
Shoot. Oh man. Okay, that just changed everything. Actually, that was actually a good question then. Okay. Well, Miss Pediatrician's looking real sus now. The only reasonable things would be like 200 to 360. And if somebody said in the 100s, I would maybe give them the benefit of the doubt. But saying 5 joules, that's like not even an option. So that's just game over. That's GG.
Has been a while since I've been in the ER. I am a dermatologist after all, but if I remember correctly, it's 150 joules.
Okay, doctor.
Right. So that one you can have some benefit of the doubt. You know, she's a dermatologist. Although she said something earlier that was super sketchy. I forgot what, but you know, that one you can have benefit of the doubt. But yeah, so far the EM guy is the most accurate answer.
6.
Yeah, so I definitely don't work in the emergency room, so I don't really work with that. I'm not sure.
That's fair.
Okay. That was a question everyone got wrong. The answer is none because you don't shock asystole. But that's something medical.
Oh, that is true. She did. Actually, I would have gotten that wrong because I mean the way you phrase the question, you're asking how much would you charge and how much would you shock in a code situation. I feel like people would just like jump to that real quick, but that is true. She did say that it was flatlined, and she was specific that it was flatlined. So that is true. You would not shock that.
TV sometimes gets wrong. Everybody comes in there with the paddles ready to go.
I don't know. I don't know
anything
the real
anymore.
deal at this point.
Yeah, I think the 5 joules was
I have a
just too
question for
because no matter how you spin it, there's no way anybody would answer 5 joules.
Dr. number 3. So earlier I asked you what system the lymph nodes are a part of. You said the lymphatic system. What's the major system that it's a part of?
I know that it recycles like dead cells, fights off infections and whatnot. I'm just like at the tip of my head. I'm just like nervous right now. So I can't.
Dr. number 1, do you know what the answer is?
I believe it's the circulatory system.
Dr. number 6, do you agree?
The immune system.
Sweet. Okay.
Okay, wait. I mean, it is kind of the immune system too. I'm kind of confused. The fact that she was like, I believe it's the circulatory system. She was kind of unsure. So I still don't think dermatologist is it. EM resident, I don't think is it. And then the pediatrician, I don't think is it. So that kind of just leaves the optometrist left.
Dr. number 5. What is the average heartbeat of a newborn versus a 1-year-old?
For a newborn, it's lower, so maybe like 35 beats per minute.
Okay. Game over. She did really well. I have to say, the very beginning, she had me convinced. She was just so confident and so well spoken. It felt good. But now the confidence is too obvious when she's saying something that's incorrect. So it's game over for her.
It elevates by the time they're 1 per minute.
Yeah, you can see the nurse like just gave the other nurse a look. Everybody was just like, okay, that's over.
It elevates by the time they're 1, obviously. So maybe like 40, 45.
Okay, I'm ready to make an elimination.
I'm ready too, yeah.
Okay.
She's got. Good question.
Doctor number 5.
Thank you. She talked about the heartbeat for a baby. That gave it away.
She answered that a resting heart rate of a fetus or infant is 35, which it'd be very concerning if it was that. They'd be not alive.
Okay, I think we're gonna have a demonstration. I was just gonna have Dr. number 6 do a little eye exam with my pen light on Andre.
Okay.
And tell us what she's looking for.
Let's see what Dr. number 6 got. Is she a pro or not?
See those skills in action.
All right, so first I'm going to be checking to see if your pupils are equally responsive to light and if they are equal in terms of size. I'm going to do the direct response first, so just look straight ahead for me, please.
She seems legit. I don't think a layperson would know how to describe what they're looking for.
Cool, so when I shine it between the 2 eyes, I'm looking to see if the other one stays constricted because that means that there's like a good communication between like the brain. So that's what I'm looking for.
Okay, that was very brief though.
Okay, doctor number 1. Can you tell me what medication you typically prescribe to patients with cystic acne?
Yes, so if the acne is bad enough, we're going to put them on Accutane, but that is a high-risk drug, so we have to make sure that the women come in every month and give us a pregnancy test. And then I also recommend to not drink very much when you're on that medication, and that goes for men as well.
Damn, that was a really good answer. That was very detailed. Definitely the reproductive issues is like the big thing. And then the way she described that was really good. Shoot. So I can't remember what she said that was bad at the beginning, but yeah, that was actually a really good answer.
Does a bar of soap clean the face pretty well?
It can, yes. I have some patients that don't even use soap when they wash their face, and they have beautiful skin. So it kind of just depends on your physiology.
Bar of soap on the face sounds kind of like an irritant, though, in my non-dermatology knowledge land.
Thank you.
We're locking in the real deal.
Oh. Are they locking in? So who are they gonna lock in? The ophthalmologist, the optometrist, or the dermatologist? I think, oh man, if I had to lock in one right now, like what was it that she said earlier? Should I go back and check? She definitely said something super sketch at the beginning. Okay, so now I remember it was when she was trying to describe inter versus intra. Maybe I should give her a pass on that because I actually had to think about it for a second on like the best way to describe it. Although she just kind of said, I forgot what intra means, but it is possible. I could give the benefit of the doubt for that. I feel like maybe she just forgot. So maybe if I was going to make a final guess, I would probably lock in. I really feel like it's either the optometrist or her. This guy, he's somehow involved in healthcare for sure. Optometrist really didn't show us that much in her eye exam. I feel like she hasn't really said anything that egregious. She just felt like a little bit unconfident in some of her answers. Or also she did say that trauma, the glaucoma one, uveitis into glaucoma. I think that probably is a possible thing. That probably is something that could happen after a trauma. So I'm really struggling between these two. I guess if I would have to lock in right now, I would lock in dermatologist, but it really could be her as well. I think he's the only one where I don't think he's a doctor. So this is tough, and it is tough because A, she didn't do like a full eye exam. Maybe she did, but they just didn't show us. And then B, she's an optometrist, so I just don't know. If she was a MD specialty, I think I would have had a better sense of if she was an MD or not.
Doctor number 6. What is that machine called that blows air into your eye?
Yeah, so that's called it's a non-contact tonometer. It measures your eye pressure to screen for conditions like glaucoma.
The cones that are in our eye, what do they do?
So they help you perceive color.
What colors do we see?
Okay, sorry, I'm trying to think. Red, green, and yellow.
Doctor number 3. Talk me through intubating someone. What are you trying not to accidentally?
Shoot, I don't know. Green and yellow, there's blue, isn't there? red, yellow, and blue? Red, green, blue. Red, green, blue, yeah. You're not red, green, and yellow. Red, green, and blue because blue and green make yellow, right? I think I'm doing that right.
Push it down instead.
You're not trying to push out the tongue so that...
The whole point is that's RGB, like RGB lights, right? So those are the 3 primary colors that like make up all the other colors. So that was a little scuss. I'm going to go with the dermatologist now still.
To accidentally push it down instead.
You're not trying to push out the tongue so that they don't or it doesn't block the airway.
Okay. I'm gonna ask one more question real quick to doctor number 1. Yes. Somebody has a mole. They want to get it checked out. What are some things they should look out for?
So changes in shape, color, if there's any pain, that's definitely something we want to know. And then throughout the mole, if there is different kinds of colors and textures, that's something that we want to look at as well.
That is all I needed.
I would have said A, B, C, D, E also. That would have really sealed it for me. But like the way she delivers that, counseling with such confidence just seems really good to me. So yeah, I think I would lock her in.
One of you is a real doctor. The other 5 of you are going to jail for impersonating a doctor.
Who would you lock in? Let me know in the comments below.
We think the real deal is Dr. Number 1.
Dermatologist. We think she was knowledgeable about everything that she explained. She didn't really know the jewels, but like she said, she's not in the ER very often.
We think the real deal is Dr. Number 1. She didn't fumble on any of her answers, and the more that she kind of got into it, the more I felt that like she was a doctor talking to me as a patient.
Yeah.
In the event that both teams lock in the real deal, the team that locked in their guess first wins.
If the lights on the floor turn green, that means that you have chosen the real deal. If they turn red, that means that you have chosen an imposter. The real deal will be revealed in 3,
red, green, yellow? That's kind of weird.
2, 1.
Oh, what the hell? Who is it? Yes, hello teams. My name is Rebecca. I am not a doctor. I was in the medical field. My original plan was to be a PA, but then I left medicine. I went and got my MBA, and now I'm in marketing.
She was so good at her answers. Was she a PA in skincare or something? Like the cystic acne answer was just so well delivered. It was so good. The intra and inter really was like a big red flag. I should have guessed that. And now that I'm watching this, I think I did watch this like multiple years ago because I kind of had an inkling of like the optometrist being the real doctor at the end. So we'll see. Yeah, she did a really good job. I just got to say, like, you really couldn't fault her for getting the jewels wrong, and all of her other answers were really, really well done.
I stopped working in healthcare 4 years ago, so it was a bit of a memory kind of situation. I was an MA for dermatology and plastic surgery.
Okay, MA for dermatology and plastic surgery. No wonder she knew the details of Accutane so well. Like, that was still her bread and butter, okay? So that totally makes sense.
Private office.
Because you were not able to find the real deal, we will reveal them to you.
I kind of thought, I kind of had it started coming back to me that I'd watched this before, but yeah, I think the red, green, yellow, missing that is honestly, it's just it's like a slip of the mind. I think you could totally understand somebody missing that potentially because you're under like a pressure-filled situation, and it's probably not something that she has to recall in her day-to-day life. Of course, she studied that and knows that it's red, green, blue, and she's probably beating herself up for not saying red, green, blue. But I think, you know, some people like crack under pressure, you know, so that definitely could have happened. All of her other answers were pretty good.
Yeah, you're close second.
And then we also didn't get to see the full eye exam, which would have been really helpful.
Yeah, you're close second.
It was right there.
I shouldn't have gone off the cones. Shouldn't have gone off the cones.
Hi, I'm Nicole, and I'm the real doctor. I think sometimes maybe the way I speak can come off a little ditzy. I don't know if it's just my own persona of myself, but I feel like some people don't really look at me and assume that I could be a doctor. I think that Dr. Number 1 did an amazing job. Like, I literally would go to her.
I was not expecting the medical fans to come in like so hot with those medical questions.
Yeah,
so they definitely gave us a run for our money. We had a good time.
I'm still bitter. That's all.
I was down between those last two, so that was...
I love it. I love it. So I wonder what that guy in the middle was, because I definitely think he had some kind of healthcare experience as well. It seemed like all three of the last ones knew something about health. And so very curious. Yeah, Dr. Number 1 did a really, really good job, and she really sold it with those answers. That was definitely a fun video. I hope they do more videos like that in the future. And let me know down below if you were able to find out who the real doctor was. I'm a little disappointed that I wasn't able to find it out, but honestly, I don't think you could really be blamed for choosing Dr. Number 1. So thanks again for watching. I'll see you in the next video, and until then, good luck and have fun.